Diane Yentel is the president and CEO of the National Low Income Housing Coalition. She joins me now. This is such a crazy situation. Just what could be the impact of the eviction moratorium expiring in a human sense? Give us a sense of the magnitude. I know you talk about an eviction tsunami.
Sure. Well, it's very clear that if the federal government doesn't act and act soon, that we are facing the possibility of tens of millions of people losing their homes this winter during this height of COVID-19. And the consequences of that would be catastrophic for children and families, for communities, and for our country's ability to contain the pandemic. And evictions can be really profoundly traumatizing and destabilizing. They lead to increased financial insecurity. They lead to harmful health consequences. And certainly now during the pandemic, increased evictions will lead to increased spread of and potentially deaths from COVID-19.
Yeah, I mean, the housing issue, what it's done is put yet another spotlight on how coronavirus has basically exposed inequality in America, racial, health inequalities, but financial too, as you say. I mean, we see the lines for food handouts, we see these evictions looming, and meanwhile, of course, Congress not doing its job.
Yes, there has been really a shocking and shameful failure on the part of the federal government to respond to COVID-19. I mean, from allowing it to spread so uncontrollably in the first place to really failing to protect low-income Americans from the financial fallout. And low-income renters, they know well what the consequences are if they are unable to pay the rent, so they do everything they can to make sure they do pay that bill. And that often means foregoing other necessities, so like store-bought food, which is why now we're seeing this just overwhelming demand at food banks. And it means other trade-offs too. It means maybe not buying that expensive medication that they or their kids need, or it means not paying the internet bill despite their kids needing that in order to get to virtual school. And renters are just really stretched very thin to the point of break.
Absolutely. And the other thing too is I think, we're talking about the moratorium expiring, but the pandemic's already seen evictions, right? I think in Texas alone, I read 17,000 evictions have been initiated since the pandemic began. 300,000 more could be coming. And that's just Texas.
That's right. The CDC eviction moratorium, generally speaking, is doing what it was intended to do, which is keep tens of millions of people who would otherwise be evicted housed during the pandemic. But it's flawed, and there are holes through which renters are falling, and evictions are proceeding. There's been at least 150,000 evictions nationally that have occurred during the pandemic. Now, if the CDC eviction moratorium does expire, we're looking at anywhere from 12 to 17 million households with up to 40 million people within them potentially losing their homes this winter.
And just quickly and finally, you touched on this earlier, but you've equated housing to healthcare. This is a health issue. Explain that.
Yes, housing is healthcare. Absolutely. Even before COVID-19, there was a very clear connection between homelessness and housing instability and harmful health consequences, from everything from diabetes and asthma to mental health challenges. And certainly now, our homes are our best protection during this global pandemic. And when our collective health depends on our ability to stay in our homes, we all have a stake in ensuring that tens of millions of people don't lose theirs.
Yeah, I saw a terrible number. I think renters right now owe an estimated $70 billion in back rent, let alone what's to come. Diane Yentel, thank you so much. Appreciate the work you're doing.
Thank you.